curious about the effects of marijuana on the human body? With more and more states legalizing marijuana, it's important to understand what happens to your body when you use it. Do you know what happens to your body when you smoke weed? From short-term to long-term effects, we're diving into the science behind marijuana and its impact on the human body. Whether you're a regular user or just curious, it's crucial to be informed about the effects of marijuana on the human body. So let's explore the truth behind the buzz. But before we go ahead, make sure that you are subscribed to our channel. Let's get started. Short-term effects of marijuana on the body. Increased heart rate and blood pressure. When you use marijuana, the active ingredient THC, tetrahydrocannabinol, causes your heart rate to increase and your blood pressure to drop. This can be especially dangerous for people with heart conditions or high blood pressure, as the increased heart rate can put extra strain on the heart. The sudden drop in blood pressure can also cause lightheadedness or dizziness, especially when getting up from a sitting or lying position. Dry mouth and eyes. Marijuana use can cause dry mouth and dry eyes, as it reduces the production of saliva and tears. This can lead to discomfort, including a feeling of thirst, a dry throat, and dry, itchy eyes. A dry mouth can also increase the risk of tooth decay and gum disease. Impairment of memory, concentration, and coordination. Marijuana use can impair your memory, concentration, and coordination. This can make it difficult to perform tasks that require focus, like driving or operating heavy machinery. The impairments can last for several hours after use, so it's important to be aware of this if you plan on engaging in activities that require mental alertness. Changes in perception and mood. Marijuana use can cause changes in perception, such as altered time perception, and changes in mood, such as increased feelings of relaxation or euphoria. It can also cause feelings of anxiety or paranoia in some people. Long-term effects of marijuana on the body. Increased risk of respiratory problems. Bronchitis. Regular use of marijuana can increase the risk of respiratory problems, such as bronchitis. This is because marijuana smoke contains many of the same harmful substances as tobacco smoke, including tar and carbon monoxide. These substances can damage the lungs and increase the risk of respiratory problems. Decreased cognitive function. Long-term use of marijuana can lead to decreased cognitive function, such as impaired memory and attention. This can make it difficult to perform tasks that require focus and concentration and can impact academic or work performance. The effects can be especially pronounced in heavy users and in people who start using marijuana at a young age. Increased risk of addiction and mental health issues. Regular use of marijuana can increase the risk of addiction and mental health issues, such as depression and anxiety. The risk is higher for people who start using marijuana at a young age or who have a family history of mental health issues. It's important to be aware of these potential risks and to seek help if you experience symptoms of addiction or mental health problems. Impact on fertility and pregnancy. Marijuana use can impact fertility and pregnancy. It can reduce the sperm count in men and disrupt the menstrual cycle in women. Additionally, use during pregnancy has been linked to low birth weight and developmental problems in babies. It's important to be aware of these potential risks and to avoid using marijuana if you're trying to conceive or if you're pregnant. In conclusion, marijuana has a range of effects on the human body, both short-term and long-term. While some effects, such as increased feelings of relaxation or euphoria, can be desirable, others, such as impaired memory and coordination, can be dangerous. Additionally, long-term use of marijuana has been linked to decreased cognitive function, increased risk of addiction and mental health issues, and decreased immune function, among other effects. It's important to be aware of these potential effects and to use marijuana with caution. If you're experiencing symptoms of addiction or mental health problems, it's important to seek help. Additionally, if you're pregnant or trying to conceive, it's best to avoid using marijuana. Remember, the effects of marijuana can vary depending on several factors, including the person's age, weight, metabolism, and tolerance, as well as the method of use and the potency of the marijuana. As research on the effects of marijuana continues, it's important to stay informed and to make informed decisions about its use. If you enjoyed today's video, then feel free to smash the like button and subscribe to our channel.